Whole world is currently suffering from novel coronavirus disease. Researchers around the globe are working hard to find the cure for this disease and other influencing factors. Several studies have found one such common factor in majority of sick people, vitamin D. In this video we will see important results of some of these studies. Are they conclusive? What role does vitamin D play? Welcome back to part 2 of Vitamin D series. Don't forget to subscribe to my channel to get more of such videos. Do hit the like button. Vitamin D is a fat-soluble vitamin responsible for absorption of calcium, magnesium, phosphate, and multiple other biological effects. Vitamin D deficiency and inefficiency is existing global public health problem affecting an estimated 1 billion people worldwide. The condition has become worse by the current lockdown. People in the UK are already advised to consider taking a supplement during the winter months and all around year if spending time indoors. Scottish and Welsh government and Northern Ireland Public Health Agency have issued similar advice for the lockdown period. If you think that vitamin D only has to do with bone health, you may be wondering what it could possibly have to do with COVID-19. Studies have found that sickest people often had deficiency of vitamin D and also that countries with higher death rates were the one with vitamin D deficient people. Some studies even claim strong association between vitamin D deficiency and COVID-19 mortality. Intervention trials have rarely shown benefits of vitamin D supplementation as treatment or preventive measures. However, one important exception is a 2017 meta-analysis of individual patients' data from around 12,000 participants in 25 randomized controlled trial, which showed that vitamin D supplementation protected against acute respiratory tract infections. Now we will see few studies claiming to found a link between vitamin D levels and how severe COVID-19 is. Researchers from UK evaluated the average vitamin D levels and the number of COVID-19 cases and death rates across 20 European countries. They found countries with low average vitamin D blood levels in the population had higher numbers of COVID-19 cases and death. Additionally, black and minority ethnic people who are more likely to have vitamin D deficiency because they have darker skin seem to be worse affected than white people by COVID-19. For example, data from UK Office for National Statistics shows that black people in England and Wales are more than 4 times likely to die from COVID-19 than are white people. The average vitamin D levels are low in Italy and Spain. Surprisingly, these countries have witnessed high coronavirus death rates compared to North European countries. North European countries have comparatively high level of vitamin D from the consumption of cod liver oil and vitamin D supplements. Second such study was done at Northwestern University. Researchers interrogated hospital data from many countries. They estimated the association between vitamin D and severe COVID-19 based on a potential link between vitamin D deficiency and C-reactive protein, a surrogate marker for severe COVID-19. In another study by Indonesian researchers, they evaluated 780 documented cases of COVID-19 and found that most patients who died had vitamin D levels below normal. In another small study, after controlling factors that can influence vitamin D levels like age, race, and chronic medical conditions, found that people who were vitamin D deficient before the pandemic began were 77% more likely to test positive for COVID-19 compared to the people who were at normal levels. This effect of vitamin D deficiency could be relevant in very ill coronavirus patients. The most vulnerable group of population for COVID-19, the aging population, is also the one that has the most deficient vitamin D levels. At least in theory, claims of these studies can be true, but theory doesn't always match with the reality. Some of the studies were small scale, some didn't control other influencing factors. Therefore, many more studies are needed to be sure enough of this relationship. However, supplementation is simple and inexpensive, and the danger of side effects and toxicity are low when taken orally. The risk of toxicity is high for people with kidney and liver diseases, as they may not be able to excrete the vitamin, so they should not take supplementation without prescription. Supplementation will bring you other benefits as well if you are deficient. Please watch part 1 of this series to know what are the chances of you being deficient and how it will affect your health. Link is in the description box. Now for the inquisitive minds, how in theory vitamin D should work. COVID-19 is caused, beside by the virus virulence, by the release of pro-inflammatory cytokines. Cytokines are protein normally released by the immune system, but in some people this reaction goes into overdrive, causing dangerous organ inflammation. Cytokine storm is being increasingly reported in COVID-19 patients several weeks after the initial infection and is linked to many deaths. Nearly all immune cells have vitamin D receptors, showing vitamin D interacts with the immune system. Many of the ways calcitriol, the active form of vitamin D, affects the immune system are: calcitriol triggers the production of natural antivirals capable of preventing the virus from replicating and entering a cell and reducing the concentration of pro-inflammatory cytokines. Second, calcitriol can also increase the number of particular type of immune cells which play a critical role in clearing acute viral infections in the lung. Third, calcitriol exerts pronounced impact on ACE2, the host cell receptor responsible for mediating infection by novel coronavirus. Coronavirus downregulates expression of ACE2. Vitamin D promotes expression of this gene. Hope you found this video simple as well as informative. For any further query, do comment. Thank you.